People living with chronic disease face a higher risk of infection from COVID and are more susceptible to severe complications and death. Jonathan Vigliotti has a story of a man who knows all too well about living during the pandemic with a weakened immune system.
For Mark Harrison, an ICU pediatrician, the Utah mountains are his safe space. He spends 12 hours a week training near his Salt Lake City home for triathlons. It's one of the rare times he can go without a mask.
I had a bone marrow transplant. I got lethal doses of chemotherapy to wipe out my own marrow.
Diagnosed with the incurable blood cancer, multiple myeloma, he went into remission after a clinical trial 19 months ago. And then COVID hit.
If you were to get COVID, God forbid, what would that mean for you?
Well, it could kill me.
Harrison is triple vaccinated. There are 7 million immunocompromised people in the United States. But for people with multiple myeloma, the immune system could have a very low response to the vaccine with limited protection.
I haven't eaten in a restaurant for 2 years.
Colin Powell's death from multiple myeloma and COVID really hit home for Harrison.
It didn't make me more fearful. It made me more excited about doing what I can with however much time I have left.
Harrison says vaccines and masks are his best defense to stay alive and wishes they were less controversial.
And I'd ask for people to keep their eyes open and their minds open and wonder about their neighbors and family members like me. Do they want to be the person who inadvertently, of course, would hurt that person they love? And I'm sure that the answer is no.
Jonathan Vigliotti, CBS News, Salt Lake City, Utah.
Pfizer says its experimental drug drastically cuts the risk of hospitalization or death in patients with mild to moderate COVID symptoms. Nearly 90% of trial participants avoided serious complications from COVID if they took the pill within 3 days of diagnosis. A Pfizer representative called the results, which have not yet been published in a peer-reviewed medical journal, quote, extraordinary. For more, let's bring in Dr. Ali Raja. He is an ER physician at Massachusetts General Hospital and a professor at Harvard Medical School. Dr. Raja, thanks for being here. So Paxlovid is a protease inhibitor, which is the class of drugs that's used to treat viruses like HIV. Explain for all of us how it works exactly.
It's a great question, Lana. As you said, this is a class of medications that we've used for decades to treat patients who have HIV. And what it does is it actually stops the protease, which is an enzyme in the cells, from helping the viruses replicate. So after the virus invades a cell and it starts producing its own RNA, protease is what helps clip that RNA and make more virus. And these protease inhibitors stop that from happening.
So Pfizer's vaccine for children aged 5 to 11 was approved this week, and Moderna is testing its pediatric shot. Still, there are parents that are hesitant to vaccinate their children. Could Pfizer's new pill eventually be an alternative to the vaccine for kids and adults alike?
Lana, it's a great question, but I really don't think so. The fact is that vaccines keep us from getting COVID. This new medication by Pfizer and the one that Merck came out with that just got approved in the UK help people who have COVID from ending up hospitalized and dying. So they're really two different steps in the process. And it's really important to still get everybody vaccinated. But then if you have breakthrough cases or you have patients who can't get vaccinated for some reason, then these oral medications can help keep them from getting more ill.
So another tool in the toolkit, but that doesn't mean that you should forego use of one of the most essential tools that are available. So I want to ask you about some other research that's coming out of the University of Oxford. These scientists say that they're beginning to understand why some people react far worse to the COVID virus than others. They've identified a gene that doubles the risk of dying from coronavirus. And about 60% of people with South Asian ancestry carry that gene, as I understand it. How does this information help doctors like you and patients in conversations about risk and in our understanding about this pandemic?
I read that article when it came out, Lana, and I obviously took it personally. I was born in Pakistan and am South Asian. So it was really interesting to me to hear that of South Asians, of whom over 60% carry the gene, as you said, higher death rates and hospitalizations than patients of European descent, of whom only 15 had that gene. But what was interesting is that that gene is not present in other minority ethnic communities that were also really hit hard with COVID in the UK. So it's not the whole story. I think over the coming months and years, we're going to find out that there are many more genetic markers that help explain the really variable mortality and effect that we saw during the pandemic.
But as it is right now, we still don't know. And that also goes to your point about why it's so important to get vaccinated and try and protect yourself early on. Along those same lines, as we saw earlier in Jonathan's piece, that there are people with weakened immune systems who are at higher risk. And getting vaccinated is not just about protecting ourselves, but also about protecting others and protecting the most vulnerable among us. Help explain this to our audience who may still try to understand this. And do you think that we've done a good enough job about the messaging around vaccines? Is there a way for us to improve our understanding of vaccines sort of as a society?
You know, it really is about preventing infections throughout the whole population. As you said, now everybody from the age of 5 up who is able to get a vaccine can get it. But like you said, there are patients who are immunocompromised, patients who have real allergies, and for other reasons can't get the vaccines. And especially for those patients who are younger than 5, those young 1, 2, 3, and 4-year-olds who can't get the vaccine, it's up to the rest of us to actually make sure we're vaccinated. What I've been talking to patients about in the ER is, look, you just met me. You're here for anything from a sprained ankle to a heart attack. Let's talk about getting vaccinated here. But even if I can't convince you, go home and talk to your doctor. Talk to your nurse practitioner. Talk to the person who you've trusted for years to take care of you and hear what they have to say. And I'll tell you that the vast majority, almost all doctors and nurse practitioners and physician assistants I know will recommend vaccination. And we need these trusted messengers who patients already trust to help convince anybody who's still hesitant to get vaccinated.
All right. Dr. Ali Raja, thank you so much for joining me, and thank you for all that you do.
Thanks, Lana.